I think that in patients who have struggled with dentures over the years, it became like for our grandparents, they would have a denture in, and eventually what happens when you wear a denture is there's pressure onto the ridge, and then there's external resorption, and now the implant becomes, or rather the denture becomes floppy. It doesn't adhere and stay in the same way. And so what we're able to do is put in 4 or 5 or 6 dental implants in the upper jaw. For example, we can also do this in the lower jaw. But for the upper jaw, what's happening is we're losing the amount of height, we're losing the amount of retention from that denture. And if we can fix in a denture, we literally take a denture and we'll screw it into the implants that were placed. And the difference is, again, one of those immediate type things that you can notice. Like, so when we do jaw surgery, we know when we come out of the operating room in a couple of hours, we've changed the patient's face. We've changed their life. And in the same way, when we come out and we're doing an all-on-4, that 2 hours after we've kind of started and we've done the reline and we've put their denture in, they look completely different. Now they can speak, they can chew and eat. They have that sense of dignity back because we're taking out teeth that maybe have had periodontal disease, or maybe they're very decayed and they feel self-conscious smiling. But when we take out the dentition, put in the implants, screw in the prosthesis, it looks beautiful. And I watch some of my colleagues and they're posting their photos and pictures, and the difference is what you can see in the eyes of the photos. You can see a difference in the eyes when they start and how happy and satisfied they are after. And it's just a tremendous opportunity to help a patient. Love it. So when a patient comes in and we want to give them a smile that day, so when they come into the office, we're going to bring them into, initially we've done all of our workup, and so we know exactly what we're going to do and the teeth we need to remove and how much of everything else that we need to do in terms of tissue removal. So we bring in a patient, we'll sit them down, and we'll start an IV, and we'll make sure that they have IV medications and they're super comfortable. So one of the things that a patient needs to remember is that they're not going to remember anything, and that they're going to be very comfortable, and they're going to be numbed up on top of everything else. And so as they fall asleep, we remove any teeth that need to be removed, and sometimes we have to reduce down a little bit of bone in order to create room for the new denture that's going to be placed. And then we'll place our implants, and then we work with a lab team too. So we'll either have the patient's general dentist in, or we'll have a lab in, and typically both. They come into our office. We have a lab within our office, so that we're able to do all the denture work, adjustments, and things of that nature, so that we're able to kind of complete the process within another hour or two. That we'll put the denture in, screw it into place, and we'll check their bite. And then we make sure that everything looks really good, wake up the patient, and show them their new smile. It's really rewarding. Yeah, it does. It's amazing what can be done in a few hours. So it's really impactful. I think the training of our staff is very important for an all-on-4 procedure, but for all of our procedures, we really do work hand in hand with I think our surgical staff is very well trained. They're very smart. They're very capable. But what we're going to be doing, and the reason that we can work quickly and efficiently, is that they're very well trained in sterile technique, what instruments that we use. They've kind of memorized. We have 4 different doctors, and they've memorized exactly how each of us like to work. And so having a team that is able to know what we're doing and understand what we're doing means that we're able to kind of work hand in hand. And I think that having that type of interaction with the team allows me to trust them as much as they trust me, and to say, hey, I'm looking at placing this implant in at this angle. How does it look from your perspective? And now we can work together, and I realize we're working in a partnership, and it's incredibly important to have that type of team, that type of trust with one another, so that we can work collaboratively and provide an excellent result for our patients. I think that using technology is super important to making an all-on-4 more accurate, in that inherently when we use materials that we have to mix up or that we take out of a syringe and we put into the mouth, because of the heat in the mouth, the materials will shrink a bit. And so as things set, they shrink, and then if you start to loosen the material, it can deform a bit as well. And so one of the things that technology is trying to do is it will put in, when we put in the implants, there'll be some posts that stick out. And instead of doing something with material, we can use an intraoral scanner, or we can use something called photogrammetry. Photogrammetry is basically when we're taking some two-dimensional pictures in the mouth. You can reconstruct them in a three-dimensional manner, and the accuracy of that is far superior to doing something that is more analog or more materials based. Material based is tried and true, and there are many experts who would say, you know what, really, I'd rather do that because in their hands they're fantastic. But sometimes when we look at what technology can do, it can improve the precision and accuracy of our restorations, which means when we put things together, we're going to be able to put our denture onto the implants. And with the type of accuracy that we have, we know the fit's good. And why does that matter? That matters because we're not going to be putting pressure or tension on our implants. And so some of the screws that we're using to screw in the denture to the implant can break. Sometimes the implants can be stressed out and get loose. And so with that type of precision and using some technology, our hope is that we're going to lessen the amount of incidences of breakage and screw loosening and these problems that we have. So technology is useful. It isn't perfect at this point, but it's really getting better. And every day we can kind of pursue that, and once again through education, in order to educate ourselves to use some of these new techniques and new technologies that makes our work hopefully superior than our work was when we were using analog. The patient smile after an all-on-4 is the most rewarding part, just to see the look in their eye, and when they hold up the mirror and they can see that they have their teeth back, and it just reminds them, I think, of what they used to have. And if we can get some photos of patients when they were younger and when they have a smile, then we can send that to the lab, and we work with excellent labs and help duplicate what they had in the past. So we're really using a little time machine in some regards, and putting the denture in, and with the all-on-4 that's screwed into place now. it feels like they're back to where they were 10 or 20 or 30 years ago. And just to see that look in their eye and the surprise that they have, it's rewarding from both perspectives. We love seeing it. I love that they're happy, and most importantly, I want them to be satisfied.